in pursuit of health and wisdom. Sapio with Buck Joffrey.
Some people think that depression is a weakness, that you can just shake it off. It's not true. Depression is a disease in the same way that diabetes is a disease. You got to treat it, or eventually it's going to lead to other diseases or even early death. And I'm not talking about suicide. Depression leads to chronic inflammation in the body. In fact, depression gives you a 64% higher risk of heart disease and takes an average of 5 years off your life if untreated. And again, those numbers don't even count more serious depression, which may result in suicide. Now, if you're depressed, you need treatment. And don't let anyone tell you otherwise. You have a disease that can, in many cases, be managed. So what are the treatments? Well, traditionally it's therapy and antidepressant medication like Prozac or Wellbutrin. But unfortunately, more than half the people suffering from major depression do not get an adequate response from the medications that are currently available. And the ones that do often lose effect over time. Now that's led to scientists and doctors to seek other options, including, believe it or not, psychedelics like psilocybin and ketamine. Now, in episode 12 of Sapio with Buck Joffrey, I discussed ketamine with psychiatrist Dr. Michael Mance. Dr. Mance talks about the extraordinary results he's seen in medication-resistant depression and says that even in suicidal patients, he sees rapid improvements in mood even within a day of treatment. Psilocybin is another psychedelic, and you may know of psilocybin through magic mushrooms. Psilocybin is the active ingredient in magic mushrooms that cause the psychedelic effects. So for several years, there have been a number of small studies that have suggested psilocybin might actually be useful as a treatment for major depressive disorder and may have powerful antidepressant effects. Well, last month, the Journal of American Medicine, JAMA, published the largest study so far, a study that was actually done by FDA standards. The authors recruited 104 people with major depressive disorder and aged 21 to 65 and split them in two. Half of the group received a single dose of laboratory synthesized psilocybin, which is a little bit different because it's not actually from mushrooms, it's made in the laboratory, and the other half of the people served as a control. Now, you might be wondering, how do you control for a psychedelic? The control group was actually given something called niacin, which causes flushing and some other symptoms that people might have reason to believe they were given psilocybin for. Anyway, the subjects were then asked to lie down and wear shades for about 6 to 8 hours. And at 6 weeks, people were assessed for depression by a third party not involved with treatment. What the authors found was that psilocybin-treated subjects had a robust and sustained antidepressant effect. In fact, almost half of them had such a dramatic effect that they were not even considered depressed anymore. The effects peaked at 8 days after treatment, but stayed there without fading up to the 6-week endpoint of the study. Now, those results were as good or even better than any trial using antidepressive medications previously reported. And remember, this was a single treatment without major side effects. So, what does this mean? Well, it means it's another advance towards effective treatment for a difficult disease to manage. The problem is that psilocybin is not legal in most states, except for Oregon and Colorado. And there you can legally pay for an experience. However, psilocybin treatment for depression is still probably a couple years away from FDA approval. So, you can either head to Oregon or Colorado, or in the meantime, you might actually consider ketamine treatment, which is available in every state. And as I mentioned before, ketamine has shown dramatic results, even in the worst cases of depression. So if you decide to try ketamine, though, I do urge you to do so in the office of a psychiatrist instead of ketamine spas that are popping up everywhere. Because one of the big things to note is that not only is it safer to be under the care of a physician, but in reality, they're going to give you the highest doses to make sure that you get the maximum effect. And there's also significant reason to believe that therapy during the psychedelic experience actually makes this a lot more effective in terms of treating depression. And again, you can learn all about ketamine in episode 12 of Sapio with Buck Joffrey, so make sure to check that out. That's it for this medical update. I'm Buck Joffrey. If you like what I'm doing, make sure you like, subscribe, and share.